something that is super important that our clients deal with, or I guess probably the best way to put it is our clients always feel the actual out-of-pocket costs of plans. Okay. So you could tell them about dental, right? You could tell them about vision. You could tell them about hearing, right? You could tell them about all these different things. But the only thing that matters in the end of the day to the client is how much they pay when they actually use their health insurance. So what are some examples of the client using their health insurance? So some examples might be their co-payments, their co-insurance, and their deductibles. All right. So co-insurance, co-payments, and deductibles. What does that mean? Okay. Co-payments. That's a portion that's a fixed rate that you pay. Okay, great. So with prescription drugs, they have a co-payment, right? So it's a fixed rate that they pay, co-payment. Okay. And then with a co-insurance, that is a fixed percentage that you pay. So it's 20%. Bill's 100 grand, you pay 20%, right? Now, with most Advantage plans, that might not be true, just because with the Advantage plans, what we're looking at here is we're looking at something that has a maximum out of pocket. And then the other cost that they might incur is a deductible, but they don't necessarily have to pay a deductible, right? It's not a bill that they have immediately. It's not like, hey, you owe 20 bucks. It's, hey, before your health insurance kicks in, you got to pay the first $500, right? Or before your prescription drug plan kicks in, you got to pay that first 500 bucks. So today's call, what I want to go into is I want to talk about our prescription drugs that's included in an MAPD, as well as just a Part D plan. So how does that operate? How does it work? It's very important for us as agents to understand this stuff and be able to explain it. Also, having the tools, right? Tools are a very important and crucial thing. That's why we love Sunfire, right? It's a great tool. It's a plan comparison tool. It helps us understand how this stuff works. So as per usual, right, every single Wednesday night, we do our training call, our Medicare training call. And on this Medicare training call, we go over everything that is related to the actual sales process of Medicare, whether it be Medicare Advantage plans, Medicare only plans, prescription drug plans, hospital indemnity plans. If we're dealing with Medicare supplements, right? So if you want to learn more about just a Plan G, well, that's something that we're going to cover in a call, right? So what is a Plan G? How does it operate? How do all med subs operate? Hospital indemnity plans. Can you go in depth? Can you teach me how to pitch them? Teach me how to sell them? I don't just want to learn about the stuff. I want to learn how to sell the stuff, right? Education is great, but I need to know how to sell the stuff, right? So some calls, we need to focus on the sales itself, the actual sales process. How do you sell? Okay. Monday evenings, we do a final expense training call. Wednesday evening, 7 p.m. Central Standard Time. Same thing on Monday evening, 7 p.m. Central Standard Time. We do a Medicare training call, right? But it's not just rah, right? It's not just learning and boring stuff. We want you to sell the stuff. We want you to learn how to sell the stuff. So I appreciate y'all for hopping on, and I'm going to get into a little PowerPoint presentation that we have here. So just give me one moment while I go ahead and I share the screen, and then we will get started with that in just a second over here. So let's get rolling. All right. So Part D explained, okay, prescription drug plans. I want you to keep in mind here that a Medicare Advantage prescription drug plan, MAPD, is encompassed in this as well. Okay, why is it encompassed in this? Very simply because the PDP itself, or the PD portion of an MAPD, covers prescription drugs. And the same exact way that a standalone PDP, or just a prescription drug plan that only gives a client's prescription drugs, that's it. That's all that it covers, right? And they got to pay a premium for it. They always do. There's always a premium associated with them, right? It operates the same exact way in an MAPD or a standalone PDP. Okay. So this is applicable to both, but this is just called Part D explained, right? Part D itself, which is prescription drug plans. So let's talk about how they work. Who are they sold by? How do they present it? Is it from the federal government, right? How does this operate? So offered by private health insurance companies, like the ones that we're contracted with: Humana, WellCare, Aetna, Cigna, Anthem, United Healthcare, all the shops, all the top companies have them. Okay. Clients must have Part A and or Part B. So they don't need to have both. That's good to know, right? And this is for a Part D prescription drug plan, right? So they don't need to have both. So that's cool. It's good information to know. Okay. In order for them to get an MAPD, Medicare Advantage plan, they do need to have both. But just for a standalone prescription drug plan, they don't need both. They have to live in the plan service area. They have to use network-based pharmacies, right? You can't just go to any pharmacy that you want. It's got to be network-based. Hey, this mom and pop shop might not be accepted, but we know every CVS, Walgreens, Walmart, Kroger, Stop and Shop, wherever you live in the country, right? Those are all accepted. The major places, which most people go anyways. Prescription drug plans, unlike Medicare Advantage plans, have a premium every single month, right? They actually have to pay a premium to have the stuff. They can have deductibles, so that's interesting, right? You got to pay $500 before your prescription drug insurance even kicks in. You pay the first $500, then we'll start paying a portion of it. Okay, so that's good to know. They use a formulary for drugs. So we'll go over that formulary. And then within a formulary, they have what's called 5 different tiers, sometimes 6, but most of the time it's 5. So a formulary, basically, it's really simple. It's just a fancy name for a list of drugs. That's all that it is. Here's a list of drugs that we cover. Okay, so that's why in Sunfire, you'll see that we type those prescription drugs in to see if it's covered under that plan. Okay, well, this drug isn't covered under it. Okay, so that's good to know. Then there's 5 different tiers, which tell us the cost. So tier 1 is going to be our preferred generic, right? So preferred generic, it's the cheapest cost for the insurance company. So they're going to give it to you at the lowest price. We prefer that you use this generic drug. Okay. Then a tier 2 is a non-preferred generic. We don't prefer that you use it, but if you need it, it's just going to be a higher cost, right? Most of the time. Tier 3 is going to be our preferred brand names. So that'll be any preferred brand name drug that they can provide you at a lower fixed copayment, right? Fixed cost. They're going to give it to you at a fixed cost, $35 for insulin. Most insulins are tier 3 with most companies now, which is amazing. And that happened around like 2018, 2019, 2020, like I would say like 2-3 years ago. We had a major change and it was amazing, right? They really fought for the seniors, and it was awesome to get a reduction in cost for insulin, because insulin was just out of control. And, you know, they really do feel this cost, right? You're paying $300 a month, but your social security check's only $2,400, right? That's greater than 10% of your check. That's just not fair to the senior. And it's just a prescription drug. You know, we got it some way, somehow there must be some subsidization program for it. So that worked out great. So tier 3, okay, preferred brand name drug. Tier 4, non-preferred brand name drug. Okay, so it's going to cost a little bit higher. Instead of $35 for a copayment, it might be $47 for a copayment. Okay, that's fine. And then tier 5 is our specialty drugs. Those are the hardcore expensive drugs. Those are generally, I mean, you might have a fixed copayment for some of them, but it usually most of the time you're going to see a percentage, a co-insurance percentage. So you got to pay 20% of the drug cost, right? And how long do they have to pay that 20% of the drug cost, right? Is the price always the same for the whole year? So that's important questions that we're going to answer. Caps out of pocket costs. So that's really cool. It's going to cap how much you pay out of pocket. There's a max. There's only so much money that you can pay out of pocket. And it's important to note that if a client that you have enrolls in Medicare, right? They're new to Medicare, they got Part A and Part B. They're not required to get Part D, but they should have it. They better have it if they don't want to pay penalties, right? Some people, I'm healthy, I don't need to pay this premium. Okay, what happens if you get cancer? And now instead of having an insurance company fighting for you to lower your prescription drug costs with fixed co-payments, right? You might be spending $60,000 of out-of-pocket cost yourself that you're going to pay. There's no insurance company fighting for you. You got Medicare pays 80%, decided not to get a prescription drug plan to go with it. So now instead of paying a small premium every single month, you're going to pay a substantial amount of money with no cap for prescription drugs. None. Terrible idea. Don't recommend you do it, but you're not required to do it. Don't recommend you do it. So next over here, we're going to look at Part D coverage phases. So this is something that's really cool, right? And as you see in the bottom, structure is the same for MAPDs and PDPs, right? That's a really, really important note. So it's going to operate the same exact way. Okay. So this is something that a lot of times can be confusing for people, right? They see these like coverage phases. What does that mean, right? We're looking at it in Sunfire and we're like, okay, well, what is the initial coverage level? What is catastrophic coverage? What's the donut hole? I hear about this donut hole all the time. Can you eat the donut hole? No, you shouldn't eat it because then you get diabetes. Donut hole, actually, you can't even eat, right? We got to figure this stuff out. So humor me for a little bit. So Phase one, deductible. Okay, so step one, you got to pay your deductible. After step one, after you have paid your deductible, and keep in mind with most Medicare Advantage plans, MAPDs, there is generally no deductible for those prescription drug plans, right? Inside of that plan, because it's encompassed in it. But for a PDP, there's usually going to be a deductible. Most of the time, there's going to be a deductible. Okay. Next, we have our initial coverage level. Then we have what's called our coverage gap, donut hole, where they got to pay a lot of money. How much? Good question. And then we have what's called catastrophic coverage, which is catastrophic for premium, right? Or how much they were paying in that donut hole. They've now have reached what's called catastrophic. So now they don't have to pay as much. So it's kind of like, hey, you paid so dang much. It was catastrophic. What happened to you? I guess is a good way to look at it. Now you don't have to pay as much once you reach these levels. Here's from a summary of benefits. So if you could tell by the blue writing, that comes from United Healthcare. Green and stuff, you're usually going to see from Humana. So what we're looking at here is we are looking at what I literally pulled from the plans or the enrollment guide that you leave behind with the client. You go on there, you order an enrollment guide, don't know how to order an enrollment guide. What is an enrollment guide? Definitely partake in the training, right? The training, we designed the training to make sure that y'all have all the information that you need. And in order for you to get all the information, start in the beginning and kind of walk your way through it. Okay. So an enrollment guide is something that you leave behind with the client. It's a very, very nice leave behind. It's great marketing material. These health insurance companies make a killing. They have the best marketing material. You don't pay anything for it, right? Don't know how to order it? Call the insurance carrier. Don't have the number for the insurance carrier? It's right in the training. Medicare carrier contact form. Pull it on up. It's got every single one. And you can go ahead and write down all your information in there. So next, let's look at these ones that we were talking about before. Okay. So here's our stage 1, stage 2, stage 3, and stage 4. And believe it or not, it explains in here exactly the different levels and how much you pay. And look at these numbers here. I want everyone to take a moment to kind of write this down. I'm going to write it down myself. Okay. And we'll get to each one and how much it is and how much it goes up for our seniors that we deal with and how ridiculous it is that it's gone up year over year. And we'll talk about the increase in cost for our clients as well, because that's very important to understand, right? They're seniors, they're on a fixed income. It's the most vulnerable people of the population who should be taken advantage of the least, right? Not the other way around. So when we have our stage 1, which is what we're talking about, that's your deductible. Everyone, you should know how a deductible works. It works the same way on your personal health insurance plan. If you've ever had health insurance before, deductible, hey, you got to pay your deductible, then the health insurance kicks in. Okay, great. Right here, this is from an MAPD. Since you have no deductible for Part D drugs, this payment stage doesn't apply. Okay, that's cool. So I instantly skip to stage 2. So stage 2, and here it shows you what the cost is going to be while you're in the initial coverage level after you pay your deductible, if applicable. Okay, cool. So how much do I pay when I'm in the initial coverage level? Good question. So for tier 1 and tier 2 drugs, if you get it through the mail with most insurance companies, WellCare, United Healthcare, Humana, right? Most insurance companies, tier 1 and tier 2 drugs, generics, you're going to get those for free through the mail for a 100-day supply. You don't have to pay anything for them, right? So if you have a client, you walk in the home and the client's like, yeah, I pick them up at Walmart and a tier 2 drug's $14 and it's a generic, you can get it through the mail for free, $0. I don't trust the mail. Well, hey, better to have more money than no money. So understand that while we're in stage 2, here's the cost, right? Remember I was talking about that tier 3, and then beneath it says insulin right here, select insulin, $35 copayment. This is a 30-day supply, right? 100-day supply over here is $105. Get it through the mail for a 100-day supply, save $10. So that's pretty cool for your insulin. So you get the insulin through the mail, you save $10 through a preferred pharmacy, mail order pharmacy. How do you do it? Setting up mail order is actually really easy. It's not complex at all. That all the doctor does is sends the prescription to the pharmacy, and it's just a mail order pharmacy. So it's OptumRx, for example, and OptumRx gets the prescription and they just mail it out. And I always tell the clients, when you get to the end of the bottle, you shake the bottle, right? And you start to hear a little bit of pills left. just call them, right? Hey, just want to make sure you all sending out my drugs. Perfect. You never want to be short on drugs, right? It's their responsibility. But I always tell them that. Okay, so that's our tier 3 fixed copayment while they're in here. Your preferred brand name drugs, excluding insulin. Insulin is the lower fixed cost. Preferred brand name drugs, $47 copayment. Okay, so cool. Tier 4, $100. That's expensive. Specialty tier, 33% coinsurance. That's expensive. And you can only pick that up at a pharmacy. Okay, so that's important to know. What happens after, let's look at stage 3 here. After your total drug cost reaches $4,130, you will pay no more than 25% coinsurance for generic drugs or 25% coinsurance for brand name drugs for any drug tier during the coverage gap. This is your donut hole, right? So essentially it's saying you're not going to pay more than 25% coinsurance, but you're going to be paying 25% coinsurance. Remember, you had a fixed rate, it was $47. Let's say that total drug cost is $1,000 and you had a fixed copayment there of $47. Now you got to pay $250. Okay. In the donut hole, which is the difference between 6,000 or stage 4 catastrophic, the difference between $6,550 and $4,130. That's why they call it the donut hole, right? It's a hole you can't fill it. The only way to fill it is by you putting money inside of it, right? It's unfortunate. So they got to pay 25% coinsurance from the difference between $4,130 and $6,550 in the year 2021, not 2022. I'm about to show you what happened to our seniors, 2022. So basically they got to pay 25 coinsurance until after your yearly out-of-pocket drug costs, including drugs purchased through your retail pharmacy and through mail order, right, reaches $6,550. So you're pretty much on the hook for $2,420. That's a lot of money, right? So they got to pay that money. But the good news is, hey, after they pass that donut hole, they only got a 5% coinsurance for these drugs. Right, so a $1,000 drug, instead of costing you $250, pretty close to what your copayment was. But it's the greater of the two. So it could be $3 and change up to about $10, right? And keep in mind, these are 2021 numbers here. So I'm going to show you 2022 numbers. Unfortunately, it was the largest increase in history for our clients. Never once has there been a larger increase in cost for our clients than in 2022. Never once. They gave them a 6% increase in their Social Security, but a 15% increase in their costs. Part B premium, largest increase in Part B premium, went from $143.50, right? $170.10, right? It's like $140. Year before that was like $135. Okay, $3, $4, $5, keeping up with inflation, not a big deal, right? Goes up that dramatically. It's for Part B premium. Different call, different day, right? But this over here, look at this. It went from that $4,130 to $4,430, 10% increase. $6,650, up $500. $500 to $7,050. That just means that they got to pay more money, right? That's all that it is. That just means that they got to pay more money, which is, really unfortunate for our clients. You don't want to raise the cost. Now it's $2,620 is what keeps you in the donut hole instead of that $2,300 that we're looking at before. Okay. So here's just another description of what it was, right? And how to apply for extra help. So annual deductible, same thing. Your plan has no annual deductible, initial coverage. And in the initial coverage limit, you pay a copayment or coinsurance for our tier 5 specialty tier for your drugs until the total cost, the amount paid by you and your plan, reaches $4,430. Good news. Not a lot of people reach the donut hole. Very small percentage. But for the ones that do, Mike and I have designed a call that's going to show you what to do for those clients that get in that donut hole. Right? We designed a whole call around how to help those clients. What about a company like Royal Neighbors of America? Okay, Royal Neighbors of America, insurance company. What do they have? Well, when you're a member of Royal Neighbors of America, you get discounts on prescription drugs. So by having that policy with them, right, whatever it is, single premium whole life, a term policy, whatever life insurance policy, you got a policy with them. you now, as a member, get discounts on your prescription drug. So that's pretty cool. So you could look using that company's resources and see, hey, maybe I can get a discount there with an insurance company by having a life insurance policy. That's pretty cool, right? They're your client. You can compliantly market to your client non-health related products. Same thing with the other stuff that Mike and I are going to go over. There's other resources that we can help for our clients. He was telling me about how he saved a client $600 a month on a drug, tremendous amount of money. So same thing over here. Once you reach that donut hole, then between this donut hole, this gap, which is $2,620, you got to pay 25% co-insurance for the drugs, 25% of the drug's total cost. And then once you hit that, then you hit catastrophic and you don't pay a lot. Extra help is a different call for a different day. So good news, only 5% of Medicare beneficiaries reach the donut hole. After you reach the total retail cost of $4,430 in 2022, you no longer pay the co-payments, you pay 25% of the cost. So the example that we were talking about, but here's another one. If the full retail cost of the drug is $400, you would pay $100, right? 400 times 25%. You stay in the stage 3 donut hole until everything that you have spent and including the manufacturer discounts, right? 70% reaches $7,050. Okay. Once you have then paid that $7,000 or you reach that $7,050 in total cost, you now have left the donut hole. You've entered the catastrophic coverage. You now will pay the difference of $3.95 for generic drug, so capped cost, $9.85 for brand name, or 5%, whichever is the greater, right? When can you change a prescription drug plan? This is just for prescription drugs. Remember, this isn't for MAPDs. Okay, October 15th through December 7th, AAP. You can make changes to your Medicare Advantage plan and Medicare prescription drug plan when certain events happen in your life, like if you move or lose other insurance coverage. These changes to make changes are called special enrollment periods. Also, we call them SEPs. You'll see us always say SEP, right? So that you'll respond to a text message, SEP. It's a reason why someone can change, LIS/extra help. Rules about when you can make changes and these type of changes you can make are different for each special election, special enrollment period, SEP. Next, what do we have here? Save money with alternatives for RX. Okay, so here's some examples, and I'm not going to go in depth on these ones because that's a different call that we're going to do, which goes way more in depth. But here's some examples that Mike compiled for me. He gave me these ones, some that I never heard of lilycares.com. I don't know how it operates, but we're going to go over that too. And I don't want to short it on time because I know we're all limited on time. So alternative ways to do it. Sometimes drugs are too expensive, even with insurance. Some key things to tell the clients, right? Simple, goodrx.com. Okay, I go to GoodRx. Jeff Poche had a client, and this client was like, hey, they paid $80, or they were going to be charged $80. I looked up the drugs, right, on GoodRx. One was $4, the other one was $8. Okay, the client now pays $12. Saved him money. Great thing. WellRx, lilycares.com, going direct to manufacturers, right? Going direct to manufacturers. How do you do it? They got to talk to their doctor, right? Their doctor is the one that's very well informed on this stuff too. And they'll show them the procedures. Doctor has to sign off on certain things as well. So keep that in mind. You can only do so much. They can also switch to generic drugs. Sometimes generic drugs don't work for certain clients, but I always tell them that, hey, if you could switch to a generic drug, by all means do it. Cholesterol, atorvastatin, cheap, right? Lisinopril for blood pressure, cheap, free, tier 1, tier 2, free through the mail. Any drugs you see on TV are expensive. I don't even know why we advertise drugs on TV. Leave it up to the physicians, not to the TV to tell you if you should be prescribed a prescription drug. So that, and if guys also keep in mind, as always, just make sure that you're writing down questions. If you have any questions, make sure we're going to take note on some of this stuff, and then we can open it up for questions in just a moment. What I'm going to do is I'm going to open up Mr. Mike Ramos, and he is going to go over a couple different things with us that he probably wants to add some stuff. I know he's always got some great insight. And like we were talking about, we're not going to go too in depth on how the clients can save money with alternative things, but we're going to cover that on the next call. So Mike, whatever I missed, didn't pick up, please add some stuff, drop some bombs.
Yeah, I mean, you covered a lot of everything. Actually, you did a great job. So that's kudos to you. The only thing that I would just want to make sure that you guys understand is that the Medicare Advantage plans versus the Medicare supplement plans. Typically, what I find is under the Medicare advantage plans, you're going to get a much. It's going to work out to your advantage to go on the advantage plan, because you're not going to have that deductible, that $480 deductible that they have for the prescription drug plans for their tier 3s, 4s, and 5s. And then you're going to also get some additional cost savings that these Medicare Advantage plans work out some deals, the insurance companies with the pharmacies, and so they're able to get you a little bit better deals on there. So if you have somebody who's taken a lot of medications, and they're on a Medicare supplement, it's always in your best interest to go look at the Medicare Advantage plans, because maybe they don't necessarily go to the hospital a lot. They don't go to the emergency room a lot, but they do use their prescriptions a lot. You're going to see a lot of value that way. And the Medicare supplements, they work out really great when it comes to medical issues. I mean, they just are. That's the best way to go. But you don't necessarily get the like for if you have someone that's diabetic, they give a lot of cost savings on the insulin programs. To my knowledge, they're not giving them on the, or at least I haven't seen them give them on the supplement plans on that side of on the standalone prescription drug plans. But you do get to see that on the Medicare Advantage plans. Like for example, Cigna has a cost sharing plan where you get $9 for your insulin, which is pretty fantastic. I mean, before the insulins used to cost 150, $200, especially when you get that donutable. Now, with the majority of them now have them for $35, but again, $9 is a lot better than 35. So you kind of got to know what everyone else is offering in your area. That's going to be kind of hard for me and Holden to know off the top of our head, because we're talking each plan is different from county to county, let alone state to state. And so there's a lot of different options there. So if you're going to offer the Medicare out, when you're offering the Medicare out, make sure you get very familiar with what each program is offering. And there might even be some smaller carriers in your area that we need to get appointed with, so that way you can get some of these deals too. But you have to let us know, so that way we can do our due diligence for you as well.
Yeah, no, then thank you so much for adding that in there. That's super important. And when you made a really good point on this too. You can't know everywhere, in every county and everything like that. So what we do that is really awesome is we have Sunfire here, which is our tool. That's our plan comparison tool over here. So you should be able to see it. And when you go into it, you create, I'm not doing a Sunfire tutorial, but what you do is you go ahead and you got your medications here in your client, and you could just start adding stuff, right? So you can add the prescription drugs in here, which is what I'm doing anyways. And, I always just ask people, hey, just go ahead and tell me what the drugs are and start punching in. Or, hey, did you add this stuff to Sunfire and do it? Because it's going to take the guesswork out of it for you. There's certain things that we know that you need us for. So we need to make sure that we are available, right? That's super important. So we're not just going to leave you to the wolves, but make sure you know how to use it.
When you give us that information, we don't necessarily, and you guys will get familiar the more you do it. The generic drugs, those tier 1 drugs, we're not really as concerned with those, because those are going to be pretty much standard across the board. What we really want to know are the Eliquis. Are you taking the Trilogy? Or what those really expensive drugs are. And again, each in your area, there are companies that often have plans that are designed for those conditions. Now, they may not be a chronic illness plan. For example, Humana. A lot of people don't know this about Humana. Humana has one for COPD, a plan. It's their 027 plan. You can get, if you join their COPD program, you have to take 3 classes in order to get educated on how to actually properly use an inhaler. And then they will cover all your COPD medications for free. And I don't know if you guys had to deal with that yet or not, but those medications can be thousands of dollars. And they are just going to cover it with a 0 copayment if you do their Humana pharmacy, or if you want to go to Walmart, you pay $10 for your prescriptions. And so people love it. And I mean, the plan itself is a decent plan, but they're not really signing up because of the medical benefits. They're signing up because of that prescription drug benefit. And so if you do have somebody that has those medications, don't be afraid to ask us.
And there's a lot of like chronic special needs plans out there that are designed for clients' health needs, right? Like, hey, how can we coordinate the care? How can we lower the cost for insulin, for heart medication? So if you're looking on this screen over here, right, I always want to type in all the drugs because I need to check the formulary, right? So carvedilol, we see it. It's going to be a generic drug. Lisinopril, generic. Meprazole. So I put all these in here, right? Just examples. I'm going to hit save pharmacy and medications. You can change the pharmacy. And what it's going to do is it's going to tell us our estimated annual cost, right? Explore potential drug savings, stuff like that. Hey, if you go mail order, you can do that. And it's going to usually save that. So this is zip code 08260, I think in New Jersey. So what we're looking at here is I need to see which plan is going to have a low cost for a client. The next plan over here, $5,216. Here's some other plans in the area that are available. Clover, it's like a local one. And it's a 3.5 star plan, so it might not be too hot. This one's 4. This one's 4. So as you can see right here, it's like, wow, this United Healthcare really is the best option. So I go ahead and I click details here. And then once I click details, I can then go to drug cost details here. And it just tells me the stuff. Right? Here's your estimated annual cost. All right, let me see a breakdown of that. Lisinopril, tier 1, free through the mail. Prevestatin, tier 1, free through the mail. Free through the mail. Free through the mail, right? Free through the mail. Humalog, okay. Insulin, $35 coinsurance. Eliquis, $47 copayment. Now let's look at our estimated annual cost. Okay. The omeprazole, I think, was a tier 2 anyways. Yeah. So these are the only drugs that will end up costing the client money. So you just sit down with your client. These first 1, 2, 3, 4, 5 drugs are $0 copayments. Insulin, $35. And keep in mind too, the insulin at a $35 copayment does not change. The copayment is $35 the whole year. It doesn't change if you're in the donut hole. Catastrophic doesn't change. It's the same. It's a fixed copayment. It's the only thing that stays the same. Eliquis, $45, right? So I scroll down and I look at it. Let's go to July. Let's see. Okay, well, it changes right here in July. It goes up. Why does it go up? Because of exactly what we just explained, right? So, all right, they hit the donut hole because it's a brand name drug. It's an expensive brand name drug too. So for the rest of the year, starting in, let's see what month it's going to start in. July, June, April. Okay, so starting in June, they're going to pay a pretty penny for it, but they're going to pay a lot less money than they would with the other plans that we were looking at, right? $5,193. Why is it so expensive? Okay, let's click details and figure it out. It's so expensive because the drug's probably not on the formulary, right? So it's going to tell you if a drug's on the formulary. Humalog, not on the formulary. That just means that it's not on their list of drugs. They don't accept it. They don't take it. That's why it's so expensive. So just put in the information in. I wouldn't know this unless I looked it up myself, right? So that's important for you guys to do. Excuse me, for you guys to do as well. So pay attention to stuff and use the tools and resources that are in front of you. All right. So questions that people might have, feel free to raise hand. Mike, you can add some more stuff if you want as well. Someone asked me if I know the cost of what it's going to go like in terms of changing costs for 2023. We don't know yet what the cost is going to be, Part B premium or coverage gap, any co-insurance, what's the extra help, co-payment. We don't know any of that stuff yet. But I will tell you one thing, it's guaranteed to be higher. I guarantee it won't be lower. So if anyone's got some questions, unmute yourself or raise hand, drop a message in the chat. Let me see over here. Scroll up. Conrad, go ahead.
Am I unmuted?
Yeah, I can hear you.
Oh, okay, great. I was wondering, you went through that drug thing and you were able to tell which one was mail order. You went through it kind of quick. How could you tell it was free mail order?
Tier 1 and tier 2 drugs are free through the mail.
Oh, just by general. Okay.
Gotcha.
Yeah.
Yeah.
I thought you were looking for something on the screen, and I kept looking. I said, "What is he looking at?"
No, it
Okay,
actually it does say it with some of the plans. So I don't remember where I was. Hold on, I'll try and find it. Let's do it live. Let's do a live test and see if I can find it. All right. So we have here. I don't know what this person was. Let me go find this contact. I hope it's this contact. Let's go view quote here. Let's see if this is the right one. 08260. Okay, cool. So let's go ahead and click this, our medications. So here's where you can choose the pharmacy. Let's say I want to use mail order. I can then change it to mail order. I then hit save pharmacy and medications. And then after that, then it'll have a change in drug cost, right? Look at
Gotcha.
that. That United Healthcare plan is no longer the cheapest. It's $10,000. Certain things you don't
Gotcha.
want to get through the mail, right? So we go over here and then we go to the drug cost details and we scroll down. Okay, we got our tier ones, tier 1, tier 2, tier 3, right? That Eliquis now went from not being expensive from $45 for the first few months to $529, $275 here, right? So that cost just went up dramatically. So that's and with the mail order over here too. So I kind of just play around with it and just kind of see. You can always ask people, hey, what pharmacy do you pick stuff up at? But we know that the mail order for tier 1 and tier 2 drugs is free based on the slides, right? So you see how much it changed. It went from $10,000 to $1,562. So it's just good to gather that information. Does that make sense?
Yeah. So in tier 4, then you have to select mail order in order to see what the cost is going to be.
No. Tier 4, you'll have that fixed copayment still.
Okay.
But the copayment does change. So let's go with this one over here. Let's just look at this tier 3 drug. The estimated full drug cost, right? $566. Right. So that's not what the client's going to be paying, though. They're going to be paying only $45. This is what the full cost of the drug is, right?
Gotcha.
For 60 tablets for 30 days, $566. This is a drug that Mike and I were talking about earlier, that he was able to save this client a substantial amount of money, right? Because maybe there's no plan that covers it out there, or maybe they reached the donut hole, right? Maybe they're in a plan right now that instead of that, $141, it is that $566 because it's not on their formulary. They're paying out of pocket. They don't know what to do. They're not the experts. They're not the insurance agents. They don't have the tools and the resources that we have. So that's why, I always want to make sure that I'm using the tools that are in front of us over here. Let me go ahead and stop share there. Can veterans use a civilian doctor to prescribe? No. VA pharmacy they need to be prescribed by a VA doctor. So that's my understanding of it. And I'm 99% sure that they need to have a doctor from the VA write that script in order for it to get filled at a VA pharmacy. It all comes from the VA itself. So it's going to be mail order. But when you see VA, when you see Veteran Affairs, VA for vets, if you guys aren't familiar with what that means, they are getting their drugs that are shipped directly to them, either at a fixed cost, a low cost, or no cost, right? So a lot of times you sit down with them like, how much do you pay for prescription drugs? Nothing. Or here's my bill, $7 for this one. So sometimes it's pretty cool because the clients can be on insulin. That would be a $35 co-insurance with, whatever insured with this United Healthcare plan we're just looking at. Whereas the VA charges a fixed cost for drugs, $10, $7, but it's never expensive. So there's certain times that we can just be creative and help our clients out, right? So that's a great question, John. Anyone else got some questions? If not, I will let y'all get back to your families and done with this boring stuff. No, for real, if anyone's got any questions, feel free to unmute yourself, raise your hand, drop it in the group chat. If not, as usual, this call is recorded. I will go ahead, clip it, and I will
Holden.
upload it. Yes, sir. What's up, buddy?
Hey, I'm a super slow typer. I'm really sorry. Hey, so I had a client with a med sup, and this is probably the wrong call for this, but
You're good.
they were declined by a couple of companies. During annual enrollment, are they guaranteed without underwriting, or is that only during their initial approval?
Yep. So Medicare supplements are underwritten. So it's different than a Medicare Advantage plan. Medicare Advantage plans have zero underwriting. So when it comes to a med sup, that is going to be, they're going to get guaranteed issue when they turn 65 or they're on Social Security disability and they enroll in Medicare for the first time. After that, there's underwriting. So
okay. So she's in her 70s, so she's going to get underwritten regardless, right?
Correct.
Okay, cool. Thanks.
Yeah, not a problem. All righty. Who else got some questions? So yeah, so start using this stuff. I know it can be confusing, but like I said, we are recording this, so you got it. And then also it's in the training too. So you can pause it, take notes, like understand the numbers. It's really good to know this stuff, right? It's super important. The more information that you have, the more knowledge that you have, the more you're going to be able to present to your clients you're going to be able to inform them at a very high level, but you got to keep it simple because you don't want to confuse them, because confused people don't buy, right? But you're just establishing yourself more as an expert, which means that they want to buy from you. They want to do business with you. So the more knowledge that you have when you join these calls, okay, the better off that you are when it comes to your sales process. So we'll teach you always how to sell them, always how to do it. But we also want to make sure that you're well informed on the stuff and how it operates, right? The inner workings of Medicare plans, of prescription drug plans, of med subs, right? And then we'll teach you how to sell them and stuff like that. So I appreciate everyone. If you don't have access to Sunfire, you will get access to Sunfire once you are contracted and certified. Contracted and certified. That's what you need in order to get access to Sunfire. So if you submitted contracting, perfect. After that, you got to get certified with the carrier, and then it'll show up so you can have the share screen real quick. Green enroll button right here. So you see the green enroll button. Can't do it unless you're appointed and certified with the carrier. So that's about it. And that's all the messages and questions that we got. Appreciate everyone. Have a wonderful evening. Enjoy time with your family. If you need us, as per usual, reach on out.